All right, sports fans, I always do that. This is show number 202, and today we're in New Orleans. At least one of us is. This is Professor Susan Hassign from good old Tulane University. What's their name? I mean, the Tulane what?
Tulane Green Wave.
Great. Okay, good. I'm sorry I asked. All right. Now you taught at Tulane University. Why is it Tulane University and not University of Tulane? Named after somebody?
It is named after someone, Paul Tulane.
That would be reasonable.
It's established since 1834.
Oh,
but I taught in the School of Public Health and Tropical Medicine.
So you're a professor or assistant or associate or
I was associate professor. I just retired last year, so I'm emerita right now. I still am connected and work with students and various units of the university from time to time.
What do you do with the students? What do you do with the students?
Often collaborate with them on projects and help them, figure out where to look for information. Sometimes do some career counseling and mentoring, things like that.
Are they undergraduate or graduate or both?
Both. I taught in both the undergraduate bachelor's program we have in health, as well as in the graduate program.
Very impressive, isn't it?
I love teaching.
So, what's full time for a professor? How many classes?
It's 12 months generally.
No, I mean how many in a semester? How many classes?
That depends on what other sources of funding you might have. I generally taught 2 classes a semester, and I did not teach during the summer, which was when I caught up on everything else.
Too hot. You went back to Minnesota. Which is really
no, not always, sometimes.
Which is really not chilly in the summer.
You had to, the challenge with teaching is that it consumes a lot of time. And so not just in the classroom time, but it's the preparation time. So sometimes more administrative things and other responsibilities slip a little bit. And so I catch up with those in the summer, work with students on publications and dissertations and things like that.
Where did you go to school? I went to City College of New York and the University of Wisconsin. So I'm a beaver and a badger.
Okay, so you did part of your schooling where I came from in Minnesota, close to it at least.
What was that?
I did my undergrad in Minnesota, that is now St. Mary's University of Minnesota. And then I did my master's and doctorate actually here at Tulane.
Wow. And then they picked you up, right?
No, then I left for 10 years and came back. I finished my doctorate in the late 80s as HIV was becoming a huge public health problem. And so I spent 2 years in what was then Zaire, now Democratic Republic of the Congo, doing HIV/AIDS research. And after that, joined a USAID-funded program that supported HIV prevention programming and efforts and services around the globe for about the next 7 or 8 years. Then I came back to Tulane.
Then you came back.
New Orleans just kind of pulls you back.
You were what was that? The Congo or
Democratic Republic of the Congo is what it's called now. It used to be called Zaire, which is what it was when I was there.
I was wondering where it went.
Pardon?
I was wondering where it went. They keep changing names.
It changed its name.
We still have our own name, though.
Yes.
Yeah. So, but the weather there must have been terrible, wasn't it?
It was not unlike New Orleans.
Ew.
So it had a monsoon season. There was never any cold. But it has a fairly temperate period of time as well. I was in the capital there, right on the equator, basically. So it was pretty stable temperature all year round. But we had our rainy and drier seasons to cope with.
You kept stepping into the different hemispheres, right?
Pardon?
You kept stepping into the different hemispheres.
Yes. It wasn't quite that close, but we were very close, yes.
They had air conditioning, right?
Well, I did in my workplace and I did in my home, but not everyone does,
No,
obviously.
no, obviously.
And ceiling fans, much as I did here in New Orleans. So it was tolerable. You wore a lot of cotton clothing and, drank
Tolerable.
cold fruit juices and water.
After you passed out, you felt fine. Tolerable, huh? What was it, 90 degrees, or it wasn't that hot?
Oh, it's been a long time since I was there, but it ranged. Daytime was 85.
Oh, chilly. Of course, it was
And
very, very.
until afternoon rainfall, and that would cool everything down so you were comfortable at night for sleeping.
Yeah, comfortable. Very humid, though.
And yeah, no, the rain helped to remove some of the humidity actually, and then it would start up again in the morning as the sun came up.
All right, sounds exciting. So, what are some of the classes you taught at Tulane?
Well, for both the undergrad and the graduate level programs, I taught an introductory epidemiology methods course for many years. First only at the graduate level, and then we began our bachelor's program about 15 years ago now. And I initiated the epidemiology methods course for that program as well. And then I did a course that focused on a broad array of infectious diseases and their epidemiology, how they moved in populations, what we could do to prevent them, things like that. And then I also taught a course that was specifically related to outbreaks of infectious diseases and how we recognize them, what kinds of strategies we can do to control them on a population level rather than on an individual level.
What exactly is the definition of epidemiology? Is that where it originates from?
Well, it's kind of an outgrowth of sociology, but it's a discipline that looks at the distribution and what causes diseases in populations. And so we do a lot of quantitative data collecting and work with data. The statistical reports that a county health department or a state health department might put out about all sorts of health conditions are one manifestation of epidemiology. But then all of the research studies that are done in public health, and most of them in medicine, rely upon an epidemiologic framework for investigation, looking at how to answer very specific questions about what might lead to hypertension or cause kidney failure, or in my particular area of interest, result in long COVID from an acute COVID infection, or the death of someone with measles or malaria.
Did you ever work on any vaccines?
Not directly. Certainly some of the information I was engaged in and supported the collection of was useful to those, and sometimes I was involved in evaluations of vaccination programs, but not specifically in the hard science development of vaccines themselves.
Now, when they develop a vaccine, they have to test it on something, right? On somebody.
Yeah,
Right.
it's a very long process. One of the amazing things about our recent experience with COVID was that it kind of melded with what had been a long-term investigation of coronaviruses after the 2003 SARS outbreak that affected, killed over 8,000 people globally, but was not anything like the one that we experienced. So there's a lot of basic research, virologic and immunologic research that was going on ever since that particular event that allowed us to respond relatively quickly with the SARS-CoV-2 problem that emerged in late 2019, 2020. And so the mRNA vaccine modality was something that had been worked on intermittently or not as intensely, certainly, as it was to produce the vaccines that most of us received in response to the COVID pandemic. But it was while it was very quick in terms of approval, part of that was driven by the fact that the government funded the process from the beginning, and it wasn't a question of having to seek funding for every stage of a vaccine's production. It went through the same steps, but it was all compressed because the barrier of resources was removed because it was such a threat to the global population.
Well, what is the definition of modality?
Modality? Oh, in vaccines, there are many different kinds of vaccines that we use for different diseases. Some of them have killed virus or antigen components in them. Others have viruses that are alive that have been weakened virologically, so they don't actually cause disease, but trigger an immune response in the person that receives them. The mRNA platform goes at the development of an immune response using a slightly different pathway, using the introduction of that antigen into a specific part of the cell reproductive process. And so it was the first time we've been successful with it, although the platform had been attempted for HIV and a couple of other diseases before this. The Johnson & Johnson Janssen HIV COVID vaccine was a different one altogether, where they inserted and used a kind of a carrier benign virus to deliver the antigen. So every vaccine is slightly different because it's trying to present the training information for our immune systems in a way that's appropriate for the disease that's trying to be controlled or contained.
They always test these out on animals first?
There can be. We have a lot of mammalian animal species that can give us good information, but those are usually used in very early stages just to see if the concept works. Mm-hmm. We also do a lot more cell-based testing now. And then the earliest stages of vaccine trials are very, very small, where we're trying to assess the level of response that can be developed, figuring out what the best dosage is to provide. If it's a multi-dose vaccine, the timing that's most appropriate to get the best immune response. All of those kinds of trials and tests are done in human volunteers in relatively small numbers. And then we get to the kinds of trials we heard a lot about during COVID, the big clinical trials with 30,000 people in them, trying to assess what benefit would accrue on a large scale from the delivery of that vaccine. And as we know, those vaccines wound up being spectacular, reducing death and serious health consequences to a very high level.
Won't it be the COVID vaccine? Is that going to be like taking the flu shot every year, you think?
I think probably the best way to think about it, that they're probably, the virus is circulating all around the world still. Yeah. It's still changing, not apparently as dramatically as it was in the first few waves of the pandemic. But I think you should just add that to your regular annual vaccine list along with the flu. Although I'm not sure getting them both at the same time is the best thing for everybody. I split them up when I got mine this fall.
What exactly, there's a vaccine for RSV. Is that another respiratory infection?
That's another respiratory virus that causes and can cause a lot of problems for young children particularly, but also for older adults. And we now have a good solid RSV vaccine as well. So if it's appropriate for individuals to get it, I would also strongly encourage it. The challenge with respiratory diseases is that they all often present with very similar early symptoms, and so you may not know what you're getting yourself into if you don't get vaccinated and then wind up getting sick. So I think when there's a vaccine available, it's a good idea to take it and rest more easily, that even if you might encounter, you're going to have a much less serious clinical experience with that particular disease.
When they come out, I just tell them, lay it on me. Go ahead. Better to take them than not.
Better to take them than not. For older adults like myself, pneumococcal vaccines are really valuable for respiratory conditions because pneumococcus is a major contributor to pneumonia consequence of bacterial pneumonias. And then the flu and COVID vaccines are key. The RSV is something that I think individuals should check with their doctors as to whether they are part of the groups that are recommended for getting that particular vaccine. I think it's a wise idea for older adults as well as children.
Do you have any idea any more vaccines that will be coming out, or the diseases they'll be working on, or all working on?
Certainly, I mean, there is always work on a variety of different vaccines kind of going on in the background. But generally, those efforts are, very methodical and low key unless there's suddenly a big. I think the two things that we need to pay attention to with regard to vaccination right now, and particularly here in the United States, is everybody needs to make sure their kids get vaccinated for measles. We're seeing some really big measles outbreaks now, and that's just not something we should have to deal with in the United States. And so part of it is because we've got some clusters of individuals that are not getting their kids vaccinated or adults that are not vaccinated. And that is a disease that can rip through a population very, very quickly. The other thing that I think we need to, I know people are working on and thinking about is this new variant of the bird flu.
Oh,
and
yeah.
So that's something to watch. It's not yet moving in human populations alone, but we have seen a few human cases, so we know that people can get sick from it if they are exposed to the animals that harbor it. And so it is something that is definitely a priority for monitoring and investigation. And I suspect there are any number of labs that are working on options for bird flu vaccine as well.
Got it. 10-minute warning. Thank you for stretching. How long is the pneumococcal pneumonia vaccine last? You know?
I haven't checked it recently. Recollection is that it's 1 to 3 years.
Is it?
In terms of bacterial vaccines, don't have the same kind of durability and long-term protection that many viral vaccines do. And so my recollection is that it's not necessarily an annual vaccine, but it is one that probably will need to be have revaccination, especially for older adults who can get very sick with pneumonia, to do that on a periodic basis. The CDC has got an abundant amount of information about that, and your clinician should be able to let you know what kind of interval might be needed for revaccination.
That's up to the doctor to tell you, though. He's got all that stuff listed, right?
Well, you can look yourself. The CDC immunization program has an excellent website that provides an abundance of information for all of the different vaccines that are recommended for different populations. And so that would be my suggestion for the most up-to-date information on timing and need for revaccination.
But your doctor would know when the last time you had it, because we don't usually keep track of when we had it. I keep track of the.
It should be accessible to you through your patient portal online. You should be able to find that information out. Also, most state health departments have an immunization tracking system. So especially if you've been in the same location for any period of time, you should be able to get, or your physician can get, a complete report of all of the vaccines you've gotten over a period of the last 10 years, for example.
Very interesting.
Important to know, when students go into college, most of them have to present immunization records. So it's something that is a not uncommon request to be handled through doctors' offices or through accessing some state health systems allow individual patients to access their information directly.
Okay. there anything else you'd like to cover today? I'm getting covered by the dog here, I tell you that. How you doing, baby?
I would, I'm a public health person, and so part of what has been always the focus of my career and those of my colleagues is, thinking about as wonderful as medicine is and the improvements we've seen in medicine, our real challenge is helping people stay healthy rather than having to get treated because they're sick. And so I would hope that people would think about what they can do, whether it's getting a vaccine or staying home when they're sick so they're not going to make somebody else catch a respiratory disease from them, or, moderating their dietary behavior to reduce heart disease or hypertension, or reduce the possibility to maintain a good healthy diet to reduce the impact of diabetes. There's lots of things that we can do from a public health perspective that will make all of us a healthier population. And that's the main focus of public health and what I've spent over 35 years of my career doing. And it's been very rewarding. I've loved every minute of it.
I know some people who don't get vaccines, period. They don't do it. Oh, it make me sick. It doesn't make you sick.
It's unfortunate. Anti-vaccination phenomena are not new. They've been around as long as vaccinations have been around, which is a long time. But it is, I think, particularly a problematic area because social media and various other forms of instantaneous communication have allowed that information and often misinformation to be spread very, very quickly. And it's very difficult to contain that and to correct those misunderstandings. Most anti-vaccination sentiment, I think, really needs to be addressed by localized, very specific kinds of efforts to get to and communicate effectively with the communities or members of communities that are so resistant, and to try and figure out why they are, and to help them understand that the vaccines are really a benefit not just for themselves, but for their whole community, their families, their loved ones as well.
Okay. Thanks for getting off my foot, by the way, Rocco. You woke up. What, do you have anything else you'd like to talk about? We have about 4.5 minutes, or...
Well, I would just...
Let's talk about your IRAs here. Let's go. We'll talk about your IRAs and Keogh. No, we won't.
Hey, you start saving money as early as you can.
Oh, yeah, right. You know how you beat inflation? Don't eat and don't buy gas. That's how you beat it.
I have a car, so I don't have to worry about that. Yes. I use public transportation almost exclusively.
All right. Well, we don't have much of that. About 25, 30 miles.
Had a good,
We're not near the city, so we don't have. We have one bus that goes.
Oh, okay.
Yeah, so it's hard to do that. I used to live in New York
It's hard
City.
when the metro center areas of most states are where you find the best transit, and once you get outside, that's what we need to fix. If we're going to get a handle on climate change and its impact on us, we need to use fewer cars and get people moving and using mass transit options that can be handled and implemented with less carbon footprint.
Okay, I want to thank you for coming on and telling us all this good information. So you can come on anytime you want, I mean, what the heck,
Well,
huh?
thank you. Thank you. If there's something big, I might reach out to you and say, Ed, we need to talk about this.
Well, fine. No problem. You got my email, so.
I do.
No problem. Yeah, well, make sure you bring. You want to have a portable air conditioner down there when you're walking on the street.
Well, it's a challenge walking on some of the streets in New Orleans, as the live oak trees wind up ripping up the sidewalks and the streets on a regular basis. But we've got a good system between streetcars and buses. It's a very walkable and livable city.
Okay, well, thank you very much for coming on. And if I need any more vaccines, let me know.
I will check for you, Ed.
Okay, thank you. Enjoy your summer down there in chilly New Orleans.
Yes, I think wistfully of the cooler evenings and winters of Minnesota when I'm in the heat of August. New Orleans weather.
Okay, enjoy Minnesota when you go back.
I will. I will.
Okay. Well, thank you again. Love,
Take care.
you too. I love the background. Very nice.
Thank you.
All right, we're going to play music here. Oh, here it goes.
Ed Sullivan is dead, but Cohen isn't. And when it comes to weather, Cohen's smart. As New York as you get, his money's on the Mets, which goes to show that Ed's a Joe who always bets his heart. You'll hear a slick review or two from Nicky. And Cantor Something Berg will sing some song. There's weather news and shtick, enough to make you sick. You'll be glad you came.